I did a previous YouTube video in reference to knee replacement surgery. I had both knees replaced in 2021, and so I wanted to kind of bring the previous video and data up to date. It's now April of 2022. My first surgery was May 12th, and the second surgery was September 22nd. I had requested the doctor to do both surgeries at once. He said no. I'm not sure whether it would have been better or not. A couple things. I guess the two most important things as you finish up using the narcotics, which hopefully will happen within the first 6 or 7 weeks. I do think narcotics are necessary, but I would get a couple of large containers of prunes because narcotics are constipating, and that can be nearly as painful as the knee pain, although the knee pain is substantial. The other thing I would recommend that you ask your surgeon or group who's involved with your surgery to extend the physical therapy. Physical therapy, I could barely limp in immediately. They took me in this 2 days after the surgeries. It extended for, I forget, either 6 or 7 weeks. I'm now 7 months out of my second surgery, and I'm still personally doing several of the exercises, and they're helpful. The other thing that's really helpful when you can is to ride a bike. Of course, I was a bike rider prior to the surgeries. I would do 15, 18 miles, 3 or 4 times a week. But now I'm doing a grand total of about 3 or 4 miles per time. I try to do it again 3, 4 times a week. And if I don't do the stretching exercises like marching or something like that prior to riding the bike, especially my left knee, which is the most recent surgery, really is painful, especially when I start. And of course, I think most PT includes a warm-up, which is riding a stationary bike. I rode a sit-down, lean-back sort of stationary bike, and we did that for like 6 minutes to begin my therapy, and that was very helpful. And it was a reminder, a confirmation that in fact, the bike riding motion is not super painful, and it's very helpful to continue to gain flexibility for the knees that have had surgery. So after 6 to 8 weeks, for me it was after 8 weeks, I stopped taking narcotics. I really wanted to get off them. I've been a drug rehabilitation counselor previously, and I just knew that narcotics are not good for you in so many ways. I had some memory loss. You could blame it on the anesthesia from the surgery or the narcotics. I'm not sure which it was, but I did have some memory loss. And, just briefly, 2021 was probably, undoubtedly, the most painful year of my life. I definitely recommend getting a helper. I had my wife who's a nurse, which made the whole process significantly easier for me. But I'm sure it was a lot more difficult for her. Just in conclusion, I'm 7 months out. I have almost no pain in my right knee, although there is some stiffness. I, on a daily basis, have some pain in my left knee, which was done about 7 months ago. I would just say that ice and ibuprofen, perhaps also Tylenol, are your friend. Narcotics are your enemy. And getting up, moving around is also very helpful. I try to walk my dog almost every day, about a mile. Initially, I did not go that far, but within 10 weeks, I was walking the dog a mile. And that has helped with my flexibility. And flexibility, the surgeon told me, is kind of the key to recovery. So I recommend that. I try to put on the ice packs. Typically now I just do one knee, the most recent surgery knee. But initially I would put ice packs on both knees for about 20 minutes, then take it off and maybe within a half hour, do another set of ice packs on my knees. It didn't necessarily take away the pain, but it acted like a counter irritant at least, and it did reduce swelling, so I highly recommend that. And you can contact me on this if you have any questions. I'm not a professional, I'm not a doctor, I'm just a patient, and but I know what it's like to go through 2 knee replacements.